My name is Noa Erlitizki, and I'm an MD PhD student. This past year, I was a Doctors for America Capella Health Advocacy Fellow working with the Access to Affordable Care Impact Area. I'm also co-chair of the Public Health Task Force within the Community Health and Prevention Impact Area, alongside my friend and colleague, Dr. El Sain, who was also a Capella Fellow this year. My first foray into advocacy was in September 2020. I was a second-year medical student. It was the middle of COVID, and I was going through a severe IBD flare. So seeking distraction during a difficult time, I connected through social media with Dr. Meena Butra, now the DFA board vice president, and joined the virtual letter writing parties she hosted in the lead up to a crucial election. In the years that followed, Mina's fierce advocacy and friendship drew me to attending protests and marches, introduced me to Doctors for America, and showed me the power of clinician voices in moving policy. While I had plenty of motivation for advocacy, I often struggled with feeling like I didn't know how to turn that commitment into concrete action. Over the course of the Capella Fellowship, I gained new tools, perspectives, and practice applying what I'd learned. I'd also realized the gap I'd felt wasn't unique to me. Many busy clinicians want to help, but aren't sure where to start. So my capstone project, the Daily 5 Advocacy Actions, was born out of the idea that having a short list of straightforward advocacy actions could lower the barrier to getting involved and help make advocacy feel more approachable. Action number 1, call your legislator. Physician voices carry unique weight in policy debates. So to make it easy to call, we provided the U.S. Capitol switchboard number and links for people to find their representatives. DFA also hosted several Docs on Call sessions, during which a call script written by my co-chair El Sain and DFA board VP Meena Butra made it easy for first-timers and experienced advocates alike to make a focused, professional ask in under 5 minutes. Second, post on social media. You can tag your senators or representatives or share an infographic or news article to help raise public awareness about a current event or important issue. Some of our biggest campaigns this year in the Public Health Task Force included a push to promote voter turnout by clinicians in the last election and helping to educate the public about vaccines during Vaccine Awareness Month. In collaboration with Impact for Health, as well as other DFA impact areas, we made infographics for these and other initiatives to make it easy to share and amplify the most important information in an approachable format. Number 3, make a short video to share publicly or through DFA's advocacy story portal. A personal, authentic message resonates on platforms like Instagram or YouTube. Last fall, as part of the Public Health Task Force's push to increase clinician voter turnout, we invited members to record short clips about why they vote and compiled them into a small video that sent a big message. Number 4, take an advocacy action. Contribute your expertise by writing op-eds, statements, designing infographics, and attending rallies. Or learn from other advocates and experts by participating in a DFA advocacy grand rounds. We hosted 2 advocacy grand round sessions, one on combating misinformation in healthcare, and another on how clinicians can meaningfully engage in policy to shape public health. One of the most meaningful advocacy actions that I personally did this year was participating in an FDA task force fly-in to Washington, D.C. Over the course of 2 days, we spoke to senators and staffers about some of the most salient issues that could impact patients, such as Medicaid cuts and NIH funding cuts. Last, but certainly not least, is number 5, recruit a friend. Advocacy grows exponentially when each of us brings in one colleague, helping to build a robust network of clinician advocates. My own advocacy journey may never have taken off if it weren't for one person taking me along for the ride to start with. And I can say with certainty that the journey itself would not have been what it has been so far without the creativity, drive, and enthusiasm of my friend and co-chair El Sain, who jumped right in when I first told her about DFA. I'd like to end with 3 core takeaways from my Capella year. First, strategy frameworks can help move ideas into action. Having blueprints like the Daily 5, call scripts, and so on makes it easy to get the ball rolling. Second, mentorship is key to guiding growth and advocacy, and it can come in many forms, including from your peers. And finally, With the right network and platforms, a single clinician voice can become a chorus for change.